Okay, so, well, this is Ingrid Dixon. I'm going to start with some announcements according to my clock. So a couple of announcements. First of all is that again, if you guys are in the statistics, compiling statistics phase, those are due to us by the 15th of every month, so today. So we're looking for your June statistics by the 15th, today. Then February 24th of 2017 is the date we have set for the 5th annual Becoming Baby Friendly in Oklahoma conference. That will again be at the Samus Center here on the OU Medical Center campus. We, at this point, don't have plans to do another reducing racial and ethnic inequities in breastfeeding conference, just because we don't have the funding. So last year we had funding from March of Dimes. So that may change, but at this point I don't have that. So I wanted to let you guys know something else, that there's a breastfeeding grand round. So if you guys can see my screen through the School of Public Health at the University of Albany in New York, they are putting on a grand rounds here with Dr. Ruth Lawrence, who wrote the book, Breastfeeding, a Guide for the Medical Profession. Here's somebody. Okay, so Dr. Lawrence, and then a few other people that are fairly well versed in women's health issues. We're putting this on. It's free. It's a live webinar, and so I have the information here. And we're also going to send it out via email with. We started sending people a survey of each of the webinars to kind of say what did you like, what did you, what could use some improvement. Anyway, so this is a good opportunity for you all to have additional information. Ideally, what I'd like to do with this, with us today is, because this is just an overview of the curriculum, I would like to not have to mute everybody, so that if you guys have questions, you can ask them. But like, we're getting some feedback right now. And so it's calling user 6. It doesn't tell me who it is. I can't say. But if you're not talking, don't have a question, if you guys could do things on your side, that way the rest of us, we can keep the lines open, so that if you have a question about what we're going to go over, you can ask at any point. I appreciate that. Okay. Because if I mute,
how do we mute ourselves on this slide again?
You can, so underneath the WebEx, there should be a thing for your audio settings. You can go in there and mute it, or on your phone, you should have a mute button. Looks like a lot of people are on the phone.
Hey,
yeah.
Ingrid, Becky.
Yeah.
I'm trying to log in on the webinar, and it's asking me for a password.
Oh, well.
So I can hear you on the phone, but I can't log into the WebEx thing.
Oh, well, there's no password.
I know.
Do you have the right meeting number?
I'm using the one she just sent, and I had actually tried using the one that I had on my calendar too. So here we go again.
Well,
it worked for me just a few minutes ago. It didn't ask me for one. Joni.
Good.
Yes. So can everybody else see my screen and got in no problem? The people that are on the phone?
I had no problems getting in. This is Cheryl.
Okay. Thank you, Cheryl.
I didn't need Allison. No problems.
Okay. Well, because what happened, and I said that I think that before Becky got on the phone, is that the ticket that we sent in through IT is that basically the teleconferencing line was down. They had to shut the whole system down and reboot it. So we were not the only people that had major challenges on Wednesday. Anyway, well, so there's the breastfeeding grand rounds. Then February 24th of 2017 is our next baby friendly conference. So you guys feel free here to just sort of jump in if you have questions about any of this stuff. Because this is the idea is to show you guys around what's happening with the curriculum. So, okay, so for those of you that are familiar with D2L, or Desire to Learn, is OU's academic It's Academic Technologies, their online learning platform. And this is where the cost comes in, is because we can't add people who are non-university employees free of charge. So, yes, you guys will mute yourselves. It'd be helpful for us. Okay. Okay. So this you would log in. So the person's going to we would set the person up. So if you enroll your staff members, you would send us an email and say we want to enroll these 20 people. Then we would set them up with user IDs and passwords, and then they would go in initially to set themselves up through OU's academic technology site or the D2L site. So they're going to log in. Okay. So this is the home page that they're going to get. There are a couple of places where you can look. So they're doing maintenance because we're a university. They do maintenance on most of our stuff during the summer. So they're doing maintenance to D2L. So it looks a little, there's lots of notices there. But you would go down and scroll, select your course here. And then this tells you welcome to the training. This gives you some how do we get the funding and what is this basically. Then you're going to go into course content. And you have a table of contents over here on your left. It also pulls it up here. Okay. And you can see the progress that's been made through the course. Each of the modules is a PowerPoint that can be viewed. It can be viewed online. It can also be downloaded, so that if somebody wanted to download it or to save it to work on it another time. But all of the content is copyright protected, so there should be no sharing of the content between staff members. So we can make it full screen if we like. This isn't displaying exactly because we're in. I've also got the webinar stuff set up. It's exactly like it does with that one we were into. So they would go through some of the curriculum here. Let me make that smaller. Go through some of the lessons here, things that we want them to learn. We look at the beginning. Each module starts with objectives. So you have your objectives, and then you have your anticipated content, so the person knows this is what we're getting into. Some of the modules will have videos or other items attached to them, just things that are pertinent for that particular topic. All of the videos are in YouTube, or they've been converted into a YouTube format. All of them play within the course content. So if your hospital doesn't allow access to various things, it should still play within here without issue. A lot of the videos are fairly short. This is a little 5-minute video. So, then we can go back into the module. You look at the test. So the test is an aggregate. So whenever you start the test, you have 3 attempts at the test, and you have to have a combined total score of 75% on the test before you can move forward. So should your a lot of times when people are taking required education, they'll go through a module and just sort of click on the answers, and then as they get it wrong, then they'll remember it, and then they'll go back and take it again until essentially they can get all of the questions correct. This doesn't allow that in the fact that you're allowed 3 attempts, and if you don't have a composite score, so you get a 100 the first time, or let's say you get a 50 the first time, then you need to get a 100 the second time in order to move forward. And if after 3 attempts you haven't gotten a total of 75%, then the content in future modules will not be accessed without permission of the instructor, which is me or Becky or Kyra, and Kyra is our administrative assistant. So one of us will have to go back in and let that person take another attempt. So we can look at a quiz here. I have to be careful about this, because this is a test student, so I can't to get the questions right because I don't want to lock myself out of the time. Okay, so the questions look like this. They have to answer each question. So babies have immediate skin contact and access to the breast within the first hour of life. Typically, select an answer, and then select the correct answer, and then save it. Then once they've gone through all of these, they go down to okay. So the first thing is you have to save all of your responses. Then it shows that they're all saved up here in the little legend. Then you go in to submit your quiz. This is, you're about to submit. Are you sure? And you say, yes, I'm sure. And then again, you get a little pop-up screen that says, hey, you're about to submit your quiz. Are you sure you've answered all the questions? Yes, submit. And then you look at your score. So this is your, so I must have answered something wrong. But so this attempt, I got 100%, but my overall grade of all my attempts, 66.7, so I won't be able to move forward. Didn't go forward. Okay. So then module 2 is similar. Do you guys have any questions about things so far? No. Okay. Well, so and the way that this works is you can look at, the person can go in and look at their grades. They can see that they got what they got on this. We're working on fixing this so that they can see their grade on all attempts. So if once we get people enrolled, we can actually make a class list for, now as a student you can't see this, but we can go into the class list and print grades out. So if you have staff enrolled in your facility and you want to see how their progress is coming along, we can print that out and send that, or we can download that and email it to the nurse manager, whoever is working with us on the staff education.
I do have a question. This is Allison.
Yeah.
Are we using this for like our entire staff education for one component of your baby-friendly education, or is this just an opportunity to do this for whomever's interested?
This is an opportunity for whomever is interested. This is more education than the doctors are required to have. The doctors are required to have 3 hours, whereas staff is required to have 20, 15 of it being this didactic education, and then 5 hours of it being on hands-on skills assessment, which is in person. So this is an opportunity to complete the required education at a low cost. So that's usually the barrier most people have as far as educating their staff is the cost to educate a large number of people.
So what would be
Ingrid, it's Becky here. I would jump in and also add, just to clarify for Allison too, that this is not what you would assign to everybody in the hospital, but only your maternity or your staff that work in, say, women's and newborn, from labor and delivery to mother baby to OB triage. So all of your hospital maternity staff that are required to have those 15 didactic hours. A 1 hour module that your general hospital staff, that would be something different. You could certainly assign this to them, but this is way more than they need to know.
So if we have 100 people working in those departments, all 100 of them need to do this?
Yes.
Okay.
Yes. Yes. So yes, for larger hospitals, yes, that for larger hospitals with a larger staff like that, that's actually where the biggest cost for baby friendly comes into play, is the staff education piece.
Right.
So that's why we've been trying to develop something like this to lower that cost as much as possible.
What is the cost?
It's $30 per person per student.
Okay.
Per staff member. Other programs tend to be several $100s per person.
And this gives them 15 hours of education.
Correct. And then the skills component, like teaching in hand expression, those sorts of things are things that you guys can do in-house, keeping record of things, or you can have Becky or I or someone else come and do that as well.
Okay.
So Ingrid, how do we pay for that? Do you just send us a bill when we register the students? Is something created and we do like a PO?
Right. Well, we can do it in a couple of different ways. The easiest way is to set you all up as a vendor, and then we would send you a bill, and that would be handled through accounts payable and whatnot. Is that you say we need to enroll 50 people, you give us those lists of people, and then we enroll all of them, and then we would bill you through a PO or whatnot, and then you all would submit payment.
Okay, and then just as we add new staff, we would just continue to send those to you to add to this program?
Correct.
Okay.
And then they have, from the time that they are enrolled, they have 12 calendar months to complete it. So so if you enroll them in July, but they don't actually start the course until August, they still have till July of the following year to finish it. So you don't want to enroll somebody, like you don't want to have a new hire who isn't starting for 30 days. Don't enroll them until they're actually on board and completed all of their orientation and whatnot. Because if
Someone would hope they can do it in less than a year. That's the other thing. They should be able to do this in a couple of months, wouldn't you say, Ingrid? So.
Oh, yes. And I think, now correct me if I'm wrong here, Becky, but I think that the goal that is recommended by Baby Friendly is that anyone who is a new hire should complete training within 6 months.
Yes.
Yeah. And so 12 months is ample, but the way that the university works, that whenever we enroll a student, if they don't complete it in 12 months, then we have to re-enroll them and they have to pay the fee again. Someone talking or trying to?
So Ingrid, another question, if they, so they can send a list to enroll, and then they need to ask us if they want a list, say, of how many of our enrolled staff have completed this to date.
Correct. We can give you progress reports, grades, where each person is at each stage. That's something that we can pull out for them via email, but it would be something that we would have to send to the nurse manager, because there's no way, well, if there are ways as far as pulling out of the class list just one person, but we can do progress reports at any point. And then if there's somebody who's struggling, like say someone has taken the 4 of the modules 3 times and been locked out of it, we may say, okay, this person is having some challenges, to help give you guys the feedback.
This is Linda. So is this something that's going to be available ongoing, so we could look at doing, say, January, February?
Yes. This is going to be an ongoing online training, and then we can enroll them at any point, and then once payment has been made, they'll be made as an active student in the course, and so then they'll get their ID and they can log in and go work on it on the unit or at their own pace.
Okay.
Ingrid?
Yes, ma'am.
This is Karen Blackburn. I apologize. I came on the call a little late, and so you may have already answered this. The Baby Friendly has an audit tool that you use to check whatever education you're using, like topic by topic by topic. So this meets all those requirements.
This meets all of those requirements.
Thank you, ma'am.
So,
and did you say when this is going to be up and running and available already?
It's up and running technically, but the university is uploading the D2L system January 28th or July 28th.
Okay.
So we expect there to be some kinks after the upgrade. So we could go ahead and get the ball rolling, but probably I would say August, the beginning of August would be a fair bet.
Okay. Thank you.
Ingrid?
Yes, ma'am.
Hey, this is Connie Brazier from Canadian Valley, and I'm sorry I got on the conference call late as well, and I think Jill's in a meeting right now. So, what is the name of this program? I missed that part of it.
So we've
for
called
the
it
training.
The Baby Hospital Initiative Curriculum is what we've called it, but we're not. Exactly what it's called. Baby Friendly Hospital Initiative Staff Education.
Staff education, okay.
And this is for your mother baby staff.
Is it the 15 hours?
Yes.
Okay. Thank you.
Then the 5 hours is the stuff that you all can do at your facility, hands-on.
Right. And you probably already mentioned the cost, but can you tell me that again too? I'm so sorry.
No, you're okay. There are several people that have joined later, so I can kind of go back over some things just to make sure everybody's here. So it's $30 per staff member, so per student.
Okay.
And they have 12 calendar months from the time that they're enrolled until they complete it. So that's
gotcha.
So if you enroll August 1st, then you have to August 1st of the following year to complete it.
Okay.
It's entirely web-based. They can do it at their leisure, so whenever they're at the nurse's station or some other point
yes.
during their day. All of the modules they're all PowerPoint, so you can either view them in this inside of D2L, or you can download them if that works better for you.
Okay.
But the content is copyrighted, so there's no sharing.
Yeah, sure.
For each one. Anyway, but it goes through, it has listed objectives, kind of this is what you can expect. And some of them, let me get into a little more
awesome.
meeting module here that has actual stuff. So
right.
that is like, what is the Baby Friendly Initiative? But it gets into more technical pictures as far as how things work. And then there are also videos associated with a good chunk of them.
Okay.
So that they can see kind of the physiology of how the lactating breast works, and all of the videos play inside of D2L.
Right. Okay, that sounds really good. And is there on the website itself? Is there just like a sample so that we could take a look at it?
This is not currently. I mean, I have a test student enrolled in this, but that's where what I'll have to do is make a tutorial video, I guess, I think, or where you guys can go in and have a look around. But the idea is that all of this stuff is housed in one easy to access place.
Right.
And then we can keep grades and whatnot as well for the people that are enrolled. So if the nurse manager or whomever is your main contact for Baby Friendly has questions on progress of a specific person or overall, we can give you reports on that as well via email.
Okay, that sounds great.
But Baby Friendly USA does not approve or credential any specific education. Like Karen Blackburn mentioned, that they give you kind of this framework or blueprint of these are the things you should cover.
Right.
Covers all of that.
Very good. It sounds quite interesting.
And this is Becky, and we hadn't gotten to that piece yet, but we will certainly go through the audit tool and make sure that we identify where all of those bullet points are addressed in this training, so that that's something that any hospital that signs their staff up for this, here's the audit tool. So that piece is all done.
That sounds good. Thank you for going back over that. And once again,
Yeah.
sorry I was late catching up on the meeting.
No, that's okay. You're I would say a good half of the people on the call came on a little bit afterwards.
Okay, great.
So I don't know I don't know if there are any other questions, or that's the basics. I think is that each one has a PowerPoint, videos, and then a test. There's going to be an overall pre and post test, which that's for the continuing education hours, is that we have to kind of monitor the effectiveness as far as did this work, as far as increasing their staff knowledge. But
right.
Becky, do you have anything else you'd like to add, or anybody else have questions?
This is Linda.
I think, yeah, go ahead.
I'm just a reminder as far as baby-friendly requirements of how recent the education was to meet the 15 hours for baby-friendly. Like in the past, say, BSEP was done 2 years ago. Is that too far back?
No, that's good. That's good.
Yeah.
Actually, that's a great question. I want to say within 5 years, but I'd have to actually go back and find where that is.
Okay.
But ideally, technically the guidelines say that they complete the big training within 6 months of hiring, and then, do you have any kind of annual updates or something that you may do for staff? So.
Okay. Okay. Thank you.
Becky, were you going to say something else?
Yes, what was I going to say? Did you mention, we are applying for CEs for this as well. So do you want to maybe show them, do we have a certificate that we can show them if they've completed it, what kind of a mock certificate looks like?
Maybe. I don't know where it is. I don't know. Well, I know you guys can see my screen, so I don't know where it is, but we could certainly come up with something. I know we have it somewhere. It's not. I don't believe it's on the. It's on this. It's something that we'll have to generate once the person completes the course and the grade is finalized in the software. Then we'll get notification that they've completed it, and then it's something that we'll send via email.
Or do we have it on our shared drive, maybe like a mock-up or something?
But I don't.
It's not a. Know where that is. Yeah, that's okay.
Right,
okay, so there is a certificate of completion that they can print out when they've done the entire course.
Correct.
And there will be a. Did you mention initial pre and post test?
Yes, but that's something that we're working on as far as the CE, as far as developing that and then loading it into here.
So Ingrid, maybe if there's, and people may think of some other questions in the meantime, do you want to show them, now that we've gotten dates, I think the lactation cram course is full. They've got a waiting list. Do you want to go on the website and just show them where we've got the other, like the online trainings that we've located from other states for physicians that might be helpful, and then the WIC trainings that might still be available. For those
right.
I don't know if we had all those dates last month.
Yeah, sure. So if you go to the Oklahoma Breastfeeding Resource Center page under training, we have online training. There's CMEs, so 2 free modules for MDs and other healthcare staff from Massachusetts. Then there's some more.
New York. Yeah. Yeah, New York was the other one.
Right. So there's less new, the child care breastfeeding supports, the free online training, and then there's supporting and promoting breastfeeding in healthcare settings, which is 4 free 1-hour modules for MDs and other healthcare staff, and that's through the School of Public Health in Albany, New York. And that's the same people that at the beginning of this call had said that they're putting on a grand round, which is building a continuum of care to support exclusive breastfeeding. It's a free webinar. Dr. Lawrence, who well known, I think, in the lactation world for writing it, the Breastfeeding Guide for Medical Professionals. I think that's right. It's called. I'd have to look at the book, but anyway, so that's a good resource for you all for additional training. Then in-person training. So there's the WIC Breastfeeding Educator course, August 4th through 5th. That is, I think they've said. Is that what Roseanne said, that they have a wait list now?
No, the lactation cram course has a waiting list now. I haven't heard that the educator course is full, and that's the one that they bring in Glenda Dickerson every year, and she's really good. She's particularly good in communicating and counseling, and just how to frame messages and education to the mothers. So that's a good extra course for people too.
Mm-hmm. Indeed. So if you have somebody who's looking for a little something extra as far as breastfeeding, or looking to send somebody from your staff, those are good choices. And those registration forms are online on our site. Then Becky, of course, has a Making Breastfeeding Easier class in October, so that's another good choice for staff. There are other things on our website that I think we've covered some of this, but there are lots and lots and lots of good resources here. So if you all are looking for information, just really, our website is pretty dense. If we find something we think is fantastic, we tend to add it. So there's all sorts of good stuff here. Anybody have any other questions for us? It doesn't have to be about this. It could be about anything with baby friendly.
I do want to alert people. I just got notice of this, that there are some Baby Friendly USA has just put out some updated guidelines. So I literally just saw that today. So we will be taking a look at that to see, are there any, significant changes, or is this just some tweaks? And let y'all know what any change in the what you need to be working on. I'm sure not any change to the 10 steps, but sometimes some of the bullet points under the 10 steps there may be some clarification or some tweaks. But we'll take a look at that and kind of put some information out to all our hospitals. Heads up, this is now what they expect. So we can work on that. And then this training, this we actually had started on a few years ago. This is a curriculum that we purchased, but it was just all text, and so we've been trying to get funding. So and you may have said this already too, Ingrid. This was we were able to complete this portion of the development of this curriculum with some funding from our state coalition, COBA, who had some national funding, and that was one thing they did to help support improving maternity care practices. So thanks, to COBA, and initially we had some funding from the CDC. So with the 15 hours, if your staff that are required to have 20 hours of education, this meets the 15 hours of didactic, and then the 5 hours, as Ingrid said, you can do some clinical skills labs and clinical checkoffs, on site with, staff that you have maybe that are trained to be qualified evaluators. You can schedule the Making Breastfeeding Easier class. We can, come to your facility and do that class, and we check them off in the skills that are required by Baby Friendly, or we do that class quarterly here on campus too, so you can certainly send staff periodically to that. And there's no charge for those classes, so you can certainly contact us if you would like to schedule that for your facility, or you've got staff that you can allocate to to address that. But the other major pieces of education that you would need to address are the 3 hours of physician education, and then not exactly a time to it, but usually say about a 1 hour overview of baby friendly that all of your hospital staff, like your maintenance workers and so forth, that you would provide to other general hospital staff. So, and we've got a sample PowerPoint that you can use for that. I know, I think Vicky's on from Integris Baptist, and Karen, I know they've used some things like that as well. So you can certainly always ask us if you're, looking for something and see we may already have it that we can provide for you. That's our job. Everybody's quiet out there. It's a Friday. So Ingrid, anything else? Oh, I see in the chat box, who do they contact to enroll staff? Ingrid, are you there? Can y'all hear me? Maybe?
Oh, I'm here. I'm sorry. I muted
Yeah,
myself.
that's okay. Yeah.
Okay.
We'll have to, we will put a little blurb on our website as well where people can go in to kind of, get an overview and get more information. And here's who you contact to enroll staff.
Right.
So,
yeah, you can contact us. We can also put something on our website as far as to send an email to enroll. Twyla asked, would this be appropriate for certified lactation counselors to work in the WIC setting? Yeah, sure.
Becky, this is Connie at Canadian Valley again.
Yeah.
Did you say that it would be available on July 28th, but then actually we can start enrolling if our facility chooses to use this as our education tool? We'll be able to start enrolling our staff the first week of August.
I think that's what I said. Yeah, I mean, it's available now, but we're having a system upgrade on July 28th, which may cause some glitches or other challenges with the upgrade. So I was saying by August, we could say for certain.
Okay, thank you.
Why don't we just, when we've got all of that up on the website about enrolling, we'll send an email out to everyone too that it's open and ready for business.
That sounds great. Thank you.
Mm-hmm. Yeah, we were hoping to say July, but then the university said, well, we're doing a big upgrade. So we thought, oh, good. As soon as we launch it, everything will get messed up. So that booted it back a few weeks.
Right, and some of it is because of the, if you guys look at just the visuals of this and some of the navigation around here, the site hasn't been upgraded, I think, since 2012. And so they're saying it just needs like a facelift and to make it a little more user-friendly. But ideally, things should still work the same as far as accessing the components and the grade. Well, does anyone else have anything else they would like from us? Our next webinar is August 10th, and it's me again. We're going to talk about overcoming staff resistance to the Baby Friendly Hospital Initiative, so kind of how to get everybody on board. And then again, February 24th, 2017 is our date for the next Baby Friendly, Becoming Baby Friendly in Oklahoma Summit. So if you all, if that's it, then if no one else has any other questions, I think we'll wrap it up.
All right.
Thanks, guys.
Thanks, everybody. Thanks, Ingrid.